Introduction. Welcome, medical students, to today's lecture on vestibular neuritis. In this comprehensive script, we will delve into the intricate details of this condition, covering topics such as its anatomy, clinical evaluation, differential diagnosis, rehabilitation therapy, and much more. Vestibular neuritis is a common disorder that affects the vestibular nerve, leading to vertigo and other symptoms. Understanding this condition is crucial for accurate diagnosis and effective management. So, let's begin our journey into the fascinating world of vestibular neuritis. 1. Introduction to vestibular neuritis. Vestibular neuritis, also known as vestibular neuronitis, is an inflammatory disorder affecting the inner ear's vestibular nerve. It is characterized by acute vertigo, typically lasting several days to weeks, accompanied by dizziness, imbalance, and nausea. Although the exact cause of vestibular neuritis is still unknown, it is postulated to be caused by a viral infection, such as the herpes simplex virus or varicella zoster virus, affecting the vestibular nerve. This infection leads to inflammation and subsequent damage to the nerve fibers, resulting in the characteristic symptoms experienced by patients. 2. Anatomy and innervation of the vestibular nerve. To better understand vestibular neuritis, let's explore the anatomy and innervation of the vestibular nerve. The vestibular nerve is one of the two components of the vestibulocochlear nerve, the eighth cranial nerve. It originates from the vestibular ganglion, located within the internal auditory canal, and consists of a superior and inferior division. The superior division innervates the horizontal and anterior semicircular canals, while the inferior division innervates the posterior semicircular canal and the saccule. 3. Differentiating vestibular neuritis from labyrinthitis. It is essential to differentiate vestibular neuritis from labyrinthitis, as both conditions present with similar symptoms but have different underlying pathologies. While vestibular neuritis involves inflammation of the vestibular nerve alone, labyrinthitis encompasses inflammation of both the vestibular nerve and the cochlear nerve. This additional involvement of the cochlear nerve in labyrinthitis leads to sensory neural hearing loss in addition to vertigo. Understanding this distinction allows for appropriate treatment and management strategies. 4. Clinical evaluation and diagnosis of vestibular neuritis. Accurate diagnosis of vestibular neuritis relies on a thorough clinical evaluation. Patient history, including the onset and progression of symptoms, is crucial in differentiating vestibular neuritis from other vestibular disorders. Physical examination features, such as the presence of spontaneous nystagmus, abnormal head thrust test, and positive head shaking test, aid in confirming the diagnosis. Additionally, various diagnostic tests, including vestibular function tests and imaging modalities, play a significant role in ruling out other potential causes of vertigo and confirming the diagnosis of vestibular neuritis. 5. Imaging modalities in vestibular neuritis. Imaging modalities are valuable tools in assessing patients with suspected vestibular neuritis and excluding other causes of vertigo. Magnetic resonance imaging, MRI, is the gold standard imaging test and not only helps visualize the vestibular nerve but also eliminates other intracranial pathologies mimicking vestibular neuritis. Additionally, computerized tomography, CT, scans may be useful in certain cases to assess for the presence of temporal bone abnormalities. However, it is important to note that imaging alone cannot definitively diagnose vestibular neuritis but rather aids in ruling out alternative etiologies. 6. Differential diagnosis of vertigo. When evaluating a patient with vertigo, it is crucial to consider a broad differential diagnosis. Various conditions can present with similar symptoms to vestibular neuritis, requiring careful consideration and examination. These differential diagnoses include benign paroxysmal positional vertigo, BPPV, Meniere's disease, central nervous system disorders, and even medication-induced vertigo. By conducting a comprehensive evaluation and ruling out these other possibilities, a definitive diagnosis of vestibular neuritis can be made. 7. Rehabilitation therapy in vestibular neuritis. Rehabilitation therapy plays a pivotal role in the management of vestibular neuritis. Vestibular rehabilitation exercises are designed to enhance central compensation for the peripheral vestibular deficits caused by the inflammation. These exercises focus on promoting gaze stability, improving balance and coordination, and reducing dizziness. Physical therapy, such as the Epley maneuver for BPPV, may also be necessary for concurrent vestibular conditions. Rehabilitation therapy aids in restoring the patient's quality of life and minimizing long-term disability. 8. Pharmacological management of vestibular neuritis. Pharmacological management of vestibular neuritis primarily focuses on symptom relief. Medications such as antihistamines, antiemetics, and benzodiazepines may be prescribed to alleviate vertigo, dizziness, and nausea. In severe cases, corticosteroids may be utilized to reduce inflammation and accelerate recovery. However, it is important to note that the use of corticosteroids remains controversial, with varying practices among clinicians. 9. Prognosis and long-term sequelae of vestibular neuritis. The prognosis of vestibular neuritis is generally favorable, with most patients experiencing a gradual improvement in symptoms over weeks to months. However, some individuals may develop persistent balance deficits, leading to functional impairment and decreased quality of life. This prolonged impairment may necessitate long-term vestibular rehabilitation and ongoing symptomatic support. 10. Vestibular neuritis in special populations. Certain populations, such as children, the elderly, and pregnant women, require specific considerations when diagnosing and managing vestibular neuritis. The clinical presentation and treatment options may vary among these populations due to age-related challenges or potential risks associated with medications or diagnostic tests. Proper management tailored to individual needs is crucial in achieving optimal outcomes in these special patient populations. 11. Vestibular neuritis in special populations. Apart from the populations mentioned earlier, individuals with comorbidities, including diabetes, hypertension, and autoimmune disorders, may present with additional challenges in the diagnosis and management of vestibular neuritis. The presence of these underlying conditions can complicate the clinical presentation, treatment response, and prognosis, highlighting the importance of a multidisciplinary approach and close monitoring. 12. Recent advancements in the treatment of vestibular neuritis. Recent advancements in the treatment of vestibular neuritis have focused on innovative therapeutic approaches, including novel drug interventions, advanced vestibular rehabilitation techniques, and minimally invasive procedures. These advancements aim to further improve patient outcomes, minimize long-term sequelae, and enhance the overall management of this condition. Ongoing research in these areas holds promise for future breakthroughs in the treatment of vestibular neuritis. In conclusion, vestibular neuritis is an intriguing disorder that affects the vestibular nerve, leading to vertigo and related symptoms. Understanding the anatomy, clinical evaluation, differential diagnosis, and management strategies is essential in providing optimal care for individuals with vestibular neuritis. As future healthcare professionals, your knowledge and expertise in this field will play a crucial role in diagnosing and managing this condition. I hope this comprehensive script has provided you with valuable insights into the fascinating world of vestibular neuritis. Thank you for your attention, and best wishes for your medical journey ahead.